Good morning and good afternoon to media in Japan and across the region joining us for this virtual press conference of the 72nd session of the WHO Regional Committee for the Western Pacific. We are coming to you, of course, from Himeji, Japan. My name is Olivia Law-Davies, and I'm WHO's Regional Communications Manager for the Western Pacific, and I'll be one of your moderators today. We're going to begin with some remarks from Mr. Hiroshi Yamamoto, Japan's State Minister for Health, Labour and Welfare, and that's going to be followed by some remarks from Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific. I'll then hand over to Mr. Yoshitaka Kitamura, the Director of the Office of Global Health Cooperation at the MHLW, who's going to moderate the question and answer portion of today's press conference. So thanks very much to journalists that have already sent in questions. We have a lot. And for journalists who connected online who'd still like to submit a question, you can do that in English or Japanese using the chat function in Zoom. Dr. Kasai is going to respond to questions for WHO, and Dr. Hajime Inoue, Assistant Minister for Global Health and Welfare, will respond to questions for Japan. So let's begin now with remarks from State Minister Yamamoto. Thank you very much.
この度は第72回 WHO 西太平洋地域委員会がここ兵庫県姫路市で開催されますことを大変喜ばしく思います。日本開催は19年ぶり、また昨年は新型コロナウイルス感染症の影響によりバーチャル開催となって日本開催が1年延期されたところであり、1年越しで開催に駆けつけることができました。新型コロナウイルス感染症は日本国内におきましては第5波がようやく収まり、またワクチン接種の進展も見られるものの、引き続き第6波への警戒が必要な状況となっております。世界各国、また西太平洋地域の各国におきましても、ワクチンのさらなる普及等、引き続きの対応が課題となっております。こうした中、各国が互いに緊密に連携し、協調し、対応していくことは、切に重要なこととなっており、我が国も積極的にリーダーシップを発揮し、これに貢献してまいります。そして、今回の本地域委員会の開催が、こうした連携、協調、対応の重要な、そして大きな一歩となるよう、ホスト国として最大限の力を尽くしてまいります。本地域委員会の開催を通じまして、西太平洋地域、ひいては世界各国がこの苦しい状況の中でも出口となる光を見出すきっかけを一つでも掴んでいただくことを記念いたしまして、私のご挨拶とさせていただきます。どうぞよろしくお願いいたします。
Thank you so much, Mr. Yamamoto. Now for some remarks from Dr. Kasai.
Thank you very much, State Minister Yamamoto, and good afternoon to the journalists in Japan and across the region. As you have heard, we are here in Himeji for the WHO Regional Committee for the Western Pacific, and I'd like to thank the government of Japan and City of Himeji for hosting this important meeting. The Regional Committee is our highest governing body, bringing together the Minister of Health and senior representatives of the 37 countries and areas across the Pacific, across the Asia and the Pacific. That makes up the Western Pacific, which is one of the 6 WHO regions and home to around 1.9 billion people. It includes the world's biggest country and the smallest, and it has a highly developed nations, fast-growing economies, and sparsely populated island states. The Regional Committee discusses important health agendas and agrees on actions by WHO and member states to address them. At this Regional Committee, we're trying a new hybrid way of bringing together government representatives, WHO experts, and partners through a combination of virtual and physical participation. For those of us physically in Himeji, it marks the first face-to-face meeting in 2 years. And to ensure the safety of participants and the host community, we have used a risk-based approach, working with the government of Japan, Hyogo Prefecture, and Himeji City to ensure the highest standard of infection prevention and control. A key topic of discussion this week is COVID-19. In the regional committee's opening session this morning, I reported on WHO's actions to help respond to the pandemic, and our regional director of health security and emergency gave a presentation on the current situation with the virus and vaccine rollout. I refer you to my speech and Dr. Orowokure's presentation for more details. But this regional committee would also address 4 other issues that are important for achieving sustainable development and for implementing the vision for the future to make this region the safest and healthiest region. First, member states will hold a panel discussion on primary health care. Primary health care has always been important, but never been more so than today, with rapidly aging populations and growing burden of non-communicable diseases and infectious diseases threat like COVID-19. We need primary health care system not only to respond to today's need, but to be ready for the future. The second, they will consider a regional framework on nurturing resilience and healthy future generation. The threat that non-communicable diseases pose to health and development in our regions calls for a new approach to school health by tackling risk factors in childhood and adolescence. And using school as a social infrastructure, we can entrench healthy habits in young people, which have a spillover effect into communities and set them up for long and healthy lives. The third is a regional framework for harnessing the role of traditional and complementary medicine for achieving health and well-being. Traditional and complementary medicine is widely used in our region, and like other services, it has evolved and modernized. It offers huge potential for helping to improve health and quality of life as a part of national health system. The fourth item member states will consider is a regional framework to end tuberculosis. Countries in our region once had some of the highest burden of TB. We have successfully reduced infections and death, but we need to tackle new challenges, such as drug-resistant TB and latent TB, and accelerating the progress in order to end tuberculosis by 2030. Before I finish, I'd like to zoom back to the COVID-19 pandemic and how to deal with this virus long-term. Even with our best effort, it now seems clear that globally, the virus will not disappear soon. While we continue to roll out vaccines and implement targeted public health and social measures, we need to expect more surges in cases and make sure health systems are well prepared to handle them and minimize the social disruptions they cause. The Japanese response offers a very good example. Every time there has been a surge in case, action were taken to suppress the transmission to avoid going over the red line and without heavy lockdowns, and lessons were drawn and applied to the next surge. This kind of continuous learning and refinement is an approach that other countries observe and apply in their own settings. Japan also showed great foresight with the 3 Cs approach, advising populations to limit time spent in closed spaces, crowded places, and close contact settings. This too has become a standard elsewhere in the region and beyond. We're now working with the countries across the Western Pacific to plan for endemic COVID-19 with a focus on protecting the vulnerable and avoiding the red line where health services get overwhelmed. And this requires actions in 5 areas. 1, effective use of vaccines. 2, continued application of public health and social measures. And 3, expanding health system capacity, including home and intermediate care facilities. 4th, early detection targeted response to flare-ups. And 5th, a risk-based approach to border controls. We also need to continue improving surveillance, communications, contact tracing and monitoring, and keep investing in universal health coverage as a foundation, not only for moving towards COVID-19 become endemic, but for ensuring we are prepared for the next pandemic. With the tools available now and the preparedness work we have done, I'm confident that working together, we can get out of this together. Thank you very much.
Thank you so much, Dr. Kasai. I'll now hand over to Mr. Kitamura to moderate the question and answer portion. Thank you.
And again, thank you all for your precious questions that have been presented to us. We will try to get through them as many as possible. And again, we will also try to take questions that you put on the chat system on this Zoom platform. 皆様、貴重なご質問大変ありがとうございました。早速、1問目から始めたいと思います。はじめに、神戸新聞田中記者から2つございます。最初の質問は、笠井事務局長へ。今回の年次総会で目指す成果について教えてください。2つ目は、井上交渉官、厚生労働省。なぜ急激に第5波から感染が下がったと分析していますか。では、笠井事務局長、お願いします。
Thank you very much for this question. One, we are addressing several very important issues this week. This includes, of course, COVID-19. We're going to discuss how to get out COVID-19 together, and primary health care, tuberculosis, schools health, traditional and complementary medicines, as I have introduced in my remarks. These issues are important for making our region safer and healthier, and also best ensure the sustainable financing. But second, we also wanted to achieve 2 bold ambitions. One is that using this regional committee in promoting the risk-based approach, which is going to be very important to live with COVID-19. And second is to set up a new style of meeting called hybrid meeting. And finally, the regional committee meeting is always aimed at connecting, establishing, and strengthening the relationship. Our region is known for solidarity in health, and we wanted to make sure that once a year gathering make our member states come all together and work together. Thank you very much.
2つ目の質問に厚生労働省井上からお答えをいたします。どうして第5波急速に感染が下がったか、いくつかの複合的な要素があると思います。一つは世界でも最も速いスピードでワクチンの接種が進んだこと、現時点で全人口の約7割の方が接種を完了をいたしました。2つ目には市民の方々の感染リスクをできるだけ小さくするための行動変容が長い期間維持をされていた、今に至るまで維持をされているということ。3つ目にはおそらくは気候の要因、気候がだんだん変わってきている季節要因ということがあると思います。ただこれだけの要因で説明できるかどうかということは分からず、まだ我々が十分に認識できていない要因がある可能性もあると思います。この点については今厚生労働省のアドバイザリーボードの方で検討が進んでいるというふうに理解しておりまして、そうした専門家の分析結果をさらに待ちたいと考えております。以上です。
りがとうございます。で続けて2つ目、読売新聞から2つございます。はじめは辻田記者、これは笠井事務局長に対してです。西太平洋地域として新型コロナとどう共生すべきと考えますか。2つ目が厚生労働省井上交渉官、冬を前に新型コロナとインフルエンザの同時流行について、現時点での可能性と起きた場合の対策について教えてください。では、はじめに笠井事務局長、お願いします。
Thank you very much. Again, this is a very important question. Unfortunately, this COVID-19 has entrenched very deeply around the world. And so globally, this virus will not disappear very soon. And therefore, it is very important for us to think how to adapt, adjust, and sustain our intervention and to cope with this COVID-19. The key is to make sure the vulnerable will be protected, and the key is to make sure that the number of cases will not overwhelm the healthcare capacity. And these 2 points is going to be the calibration point. Calibration means adjusting the strength of these interventions to make sure we can bring the economy and people's life back. And what is important is to make people get vaccine, and two, to make sure those public health and social measures to be continue, as I mentioned, in such a way, adapt, adjust, and sustain. And obviously, the more we have healthcare capacity, the more we can push back the red line. So it is very important to continue to strengthen the healthcare capacity. And lastly, we're also interested in observing the country's experience. If there's a surge, I think it's better to detect those surges early and then to suppress. As I mentioned, that the virus is widely entrenched, so we should continue to anticipate the surge to be repeated, and therefore it's better to detect earlier and then suppress. And to do that, surveillance, communications, and contact tracing and monitoring is continue to be very important factors. Thank you very much.
2つ目の質問、新型コロナとインフルエンザの同時流行に関してです。幸い昨シーズンはインフルエンザの流行がほとんど起こりませんでした。これからの冬のシーズンにどうなるかという可能性については明確な予想はできません。ただしこれは危機管理ですので、起こり得るという想定で準備をしなくてはいけないと思います。起こった時の対策については、一つは発熱症状が起こった時に身近に受診できる診療所、医療機関を適切に各地域で準備をすることというのが一つ。二つ目、臨床症状でこの2つの疾患の鑑別をすることはできません。したがってオンダスポットで迅速にそれぞれの疾患を診断できる体制を整えるということが2つ目。3つ目は、幸いにして今日はそれぞれの疾患、適切な治療薬が開発されるようになりました。適切なタイミングでそれぞれの診断に基づいて治療薬を地域地域で提供できる体制を整える。こうした基本的な対策を準備をするということが大事だと考えております。以上です。
Thank you very much. We will next move to a question from Philippine News Agency, Janice Cave. This is to Dr. Kasai, RD. Would the Delta variant continue to be a major driver of infections, or is it possible that a new, more lethal variant arises? If so, what do we need to do to make sure that this doesn't happen? Dr. Kasai.
Thank you very much. This virus will definitely continue to evolve and mutate as far as the transmissions continues somewhere around the world. So what is very important is to suppress the transmission. And what is also important is to set up a system that we can monitor those evolvement, mutations. And in these regions, we have set up the whole genome sequence network and also start helping countries develop the capacity system to monitor those mutations. Thank you very much.
ありがとうございます。続けて、産経新聞小林記者および、サウスチャイナモーニングポスト GMA からの質問です。3回目のワクチン接種を日本は行おうとしていますが、WHO 西太平洋地域事務局は、一部の国が行う3回目接種をどのように考えておられますか。笠井事務局長、お願いいたします。
Yes, thank you very much. This is the scientifically very complex and evolving areas. Evolving areas means new evidence continues to comes out. So far, what we know is there are group of people, the primary series or the regimen means if this 2 doses required 2 doses, 1 dose, 1 dose, would not make sufficient protections. Those people are such as immunocompromised people, like after transplantations operations. Then we need additional doses to protect these people. Now, booster refers to the vaccine doses given after those primary series of vaccine. And so far, we don't have evidence when and who should get those booster vaccines for the WHO emergency use listed vaccines. But what we know is that this vaccine is very effective, continue to be very effective in preventing severe diseases or the hospitalization. And therefore, it is very important to make sure those priority groups, such as healthcare worker, older people, those who have a high risk, and eventually to more broad and broader people to have a primary series finish within the country. But now, not only within the country, it is very important to make sure the people around the world to complete this primary series of vaccination. It is very obvious this virus doesn't respect the border, and therefore, unless every country is protected, no country is safe, and that's what we are very much advocating to the world. Thank you very much.
ありがとうございます。続けて共同通信岩村記者、この質問はマニラタイムズとフィリピンニュースエージェンシーからもいただいています。これも笠井事務局長お願いいたします。感染症対策において域内の各国はどのような支援を必要としていますか。またワクチン配分の現状と課題について教えてください。事務局長お願いします。
Thank you very much. I have mentioned that during this meeting, we start to discuss how can we get out this COVID-19 together by making this COVID-19 as endemic. And I pointed out vaccine, and then not just vaccine, but combined with the public health and social measures, and strengthen the healthcare pathway, and then the early detection targeted response. And to do that, surveillance, communications, contact tracing. With that in mind, what kind of support countries needed is definitely number one, vaccine. We have to make sure that every country have access to vaccine and have a sufficient coverage. But in the same time, they really need some kind of support in making sure their healthcare capacities will be continue to be improved. And those supports include like a clinical training and then the provision of essential medical supplies. But it is also important, as I received in earlier questions, the surveillance, which also already includes the whole genome sequencing surveillance, so that they can continue to monitor the mutations of the vaccines. Thank you very much.
Thank you, Dr. Kasai. Next question also goes to you, Dr. Kasai. From DevEx, Jenny Ravello. Could you comment on what WHO knows about Merck's candidate oral pill Molnupiravir, and what messages do you have against the huge interest for this pill in the Asia-Pacific region and around the globe? Dr. Kasai.
Thank you. We welcome the new tools, including antiviral development, to respond to COVID-19. And we look forward to receiving the full data for our independent panel of experts to review, offer which it can be considered by guideline development. But one is a efficacy, effectiveness, but when we translate that into actual actions in the use of the field, we also have to consider the production capacity, availability, including the price range. And we wanted to continue to work closely with the member states, how we can make sure those effective tools to be available for the people in this region. Thank you.
Thank you, Dr. Kasai. Next goes to Dr. Inoue, Health Ministry. From Manila Times, Red Mendoza. The Tokyo Olympics is considered as a test case on how sporting events could be held successfully under COVID without major issues. How was Japan able to hold the Olympics, and what are the lessons that can be learned for future multi-country sports events under a continued presence of COVID-19? Dr. Inoue, please.
Thank you very much. There was no actually magic bullet. We just stick to the very basic. First, adequate quarantine. Second, minimize the physical contact between Japanese citizens and athletes coming from abroad. Third, frequent test. And in case of positive cases detected, trace and isolate. We are very pleased to show the actual evidence and example of this very basic approach actually worked in the real world settings. Thank you.
Thank you very much. Next goes to Dr. Kasai. A question from the Hong Kong Standard, Mary Ann Benitez, as well as Philippine news agency, Southern Metropolis Daily, and ABS-CBN. The question is, WHO has said that the pandemic will, quote, go on for a year longer than it needs to be, end quote, because poorer countries are still not getting the vaccines they need, and it could, quote, easily drag on deep into 2022, end quote. Do you agree? And is it also the same dire predicament for the Western Pacific region? Dr. Kasai.
Thank you very much. If I understand that question is about when this pandemic will finish. And this is a question I receive very frequently. Nobody can really predict this pandemic would end. But actually, half of the answer to that question depends on actions that we take. The actions we take, I have already mentioned, that we have to make sure that we have a vaccine. And we have to make sure not just the vaccine, but continue public health and social measures, which include individual to continue to practice in managing the risk of COVID-19 to protect their family and communities. And we may have to also conduct the cluster investigations and come up with the approach to reduce the risk of those high-risk areas. And we have to also prepare still the population's approach in case the number of cases continue to surge. And the third is about the healthcare capacity. The more we have a healthcare capacity, we have more chance to make this COVID-19 us able to live with, cope with it. And then, of course, we need a good surveillance system to detect the surge earlier, and then calibrate, and then put those mitigations earlier, so that we can continue to suppress. So all those effort is to try to make the community able to cope with this COVID. And I think 2 or 3 weeks ago, Singapore announced that they're anticipating 3 to 6 months to go for achieving those kind of status. It would depend on the country how quick they can reach this point. And WHO wanted to continue to work closely with the member states and helping these countries to have this capacity. Thank you.
Thank you, Dr. Kasai. The next is also to you, Dr. Kasai, from Southern Metropolis Daily, Yijing Yu. What is your comment on China fighting against COVID-19? Dr. Kasai.
Thank you very much. China has been known for a very strong capacity in dealing with the COVID-19. They have kept a strategy for zero COVID, and therefore they have a very strong surveillance system, not only monitoring the people's symptoms, but they also have an active surveillance system, including monitoring the environment to detect the virus as early as possible. And once they have detected, they do test whether if there's a people who has those cases, and then they will put a very strong intervention. And what I have understand is that the society, people are supporting those interventions, because with this strong intervention, they can also bring back their life almost close to the normal early. And we've been learning from the experience of China, and we keep sharing those experiences of China to other countries, so that other countries can continue to learn and improve their response. Thank you.
ありがとうございます。あと、まだ時間ございます。もういくつか取りたいと思います。共同通信、岩切記者、これも葛西事務局長に対してです。仕切り直しとなったコロナの起源調査について、どのような成果が期待できますでしょうか。ウィプロの役割については、どのようにお考えでしょうか。葛西事務局長、お願いします。
Thank you very much. The study of the origin of the virus is very important to prepare and prevent the next pandemic. It is an important study that requires every country around the world to collaborate. And I wanted to appreciate China for allowing us to have a joint mission to learn and then understand what happened in China. Currently, at the global level, there is an ongoing process of establishing a scientific committee to continue to study the origin of a virus, not only for this COVID-19, but also setting up the system to be ready for next pandemic. Thank you very much.
Thank you, Dr. Kasai. Next also goes to you, Dr. Kasai, from GMA Brine Sales. What is your opinion on the Philippine Department of Education's decision to implement face-to-face classes for select schools next month? Dr. Kasai.
Yes, thank you very much. I have mentioned that the public health and social measures, and one of that is the risk-based approach. If there is any high-risk area, why not you put the risk mitigations measures and continue to organize that? School is one of that. We have learned from our colleagues who is expert on education, that school closure affect children significantly. And not only the children, the prolonged school closure also affect the community. And therefore, the right question is not whether we can or cannot, but important things is that in what kind of setting, what kind of risk mitigations measure we implement so that we can continue to open the schools. But obviously, school itself cannot move out from the community, and therefore it's very important to continue to do the risk assessment of the community and then adjust those mitigations measures. And more importantly, to make children able to go to school, we need help from the people in the community to continue to do their practice to mitigate the risk so that COVID-19 can be suppressed in their community and children can safely continue to go to the schools. Thank you very much.
Thank you, Dr. Kasai. I have another question for you from ABS-CBN News, Raf Bosano. With daily cases in the Philippines declining and healthcare utilization rates also sliding towards safer levels, what else would the WHO recommend the Philippines to do in order to sustain the decreasing numbers and for life to be able to go back to normal? Dr. Kasai, please.
Thank you very much. Actually, I'm very happy to see the number of cases going down in the Philippines, and not only in the Philippines, but several countries in our regions. But as I mentioned, that the virus is really widely now entrenched around the world. So we should anticipate this virus would continue to surge within the countries. And therefore, it's very important for us to shift our approach and then make a society resilient and able to cope with those continuous surge. And the key is, again, vaccinations. Philippines are really trying hard to increase the vaccination coverage nationwide, and that is very important to continue, particularly the healthcare worker, elderly, high-risk people, and then gradually to the older population nationwide. And secondly, even vaccines coverage is high, it is also very important to continue to have a public health and social measures. So we need to continue to do personal protective measures, such as masking, keeping the social distance, and then in case if you have some symptoms, stay at your home. But also important is that continue to increase the healthcare capacity so that even in case the surges occur, they can still cope with it. And finally, in case if the surge starts, why not we detect that earlier and suppress them? So these are the key components that we wanted to continue to work with the member states to make society resilient and shift that society able to cope with the COVID-19. But the key calibration point is to protect the vulnerable and also to make sure those surges would not pass the line, we call it red line. The number of critical cases exceed the ICU capacity. Thank you very much.
ありがとうございます。次は厚生労働省井上厚生官に対する質問です。神戸新聞の井上記者からです。ワクチン接種が進む一方、第6波や新たな変異株への懸念もあり、コロナ対策はまだ気の抜けない状況が続いています。コロナ施策は国や都道府県が主導するケースが多いですが、姫路市をはじめとする自治体、市町村はどのような対策や準備を進めていくべきでしょうか。お聞かせください。井上厚生官、お願いします。
ご質問ありがとうございます。コロナ対策は国、都道府県、基礎自治体3つそれぞれに異なる役割があり、それぞれが役割を発揮することが大切だと思います。基礎自治体の強みというのは、国や都道府県にはない強みというのは、それぞれの地域を一番よくご存知であるということです。その強みを生かした対策準備をしていただければと思っております。具体例を挙げると、例えばワクチン接種、全人口の7割までワクチン接種が達しました。どこの国も6割、7割を超えると接種率、接種のスピードが落ちてきます。 なかなか最後の1割、2割、3割のところに接種を行き届かせるということが非常に難しい、それぞれの地域でなぜ接種をしない人々がいるのかという状況は異なってきます。それぞれの基礎自治体において、どういう方々が接種にアクセスしにくいのかということを同定の上で、それぞれ市町村独自の働きかけをしていただければというのが一例です。もう一つ例を挙げます。冬に入るとこれからインフルエンザ、コロナ同時に流行ということが懸念されます。それぞれの地域において外来の発熱センターの準備をすることが急務です。こうした準備というのはもちろん国や都道府県がプランを作りますが、一番最後のところ、どういう医療機関に何をお願いするかということは、地元の医師会等と一番強い連携ができる基礎自治体ならではの仕事だと思います。国、都道府県とは異なる基礎自治体ならではの強みを生かした対策を今後とも期待をしております。以上です。
ありがとうございます。続けて、笠井事務局長に対して、薬事ニュース社の小畑豊和記者からです。コロナパンデミックから得られた感染症対策の知見を、各国の次世代に対する普及啓発として、どのようなことが求められるでしょうか。笠井事務局長、お願いいたします。
If I may clarify the question is about the important message for the next generation, the youth.
Yes, I think so.
そうです。
Okay. Thank you very much for very interesting questions. It is very important, well, I believe it's very important for us to constantly learn and then improve. When we start responding to COVID-19, we used our experience based on the SARS in 2003, and then our preparations to influenza pandemic. But since then, we continue to learn and improve. And within that, I see very important one message that I wanted to pass it to the next generation, is that the virus, they don't respect the border. And so as far as this virus exists somewhere around the world, no country is safe. In a simple words, that the global health requires the solidarity. And to solve the issue of the global health, we need every countries to come together and work together so that we can get out of this problem together. Thank you.
Thank you, Dr. Kasai. I'd like to take one last question, again to you, sir, Dr. Kasai, from the South China Morning Post, Simone McCarthy. You mentioned that the session will discuss risk-based approach to border controls. Could you explain what this means in greater detail, and if this is to say that countries should be considering opening borders and relaxing controls at this time? Dr. Kasai.
Risk-based approach starts with the question how important that issue is. So each country needs to question how important this border control would be. And the border means it's an interface to the other parts of the world, but it's also part of the country. And therefore, this risk-based approach needs to also assess what kind of capacity exists within the country. So start with how important this issue is, and second, what kind of response capacity we have. And when we talk about how important this issue, we should also have to think the degree of restrictions for complete closeness to complete openness, what level of risk that can bring into the country. And with that risk and then the response capacity, each country can make decisions on what level of border control that they can make. Thank you very much.
Thank you, Dr. Kusai and Dr. Inoue. This concludes the Q&A. Back to you, Olivia.
Thank you so much to all of our speakers today, to all of the journalists who were connected online. We really appreciate the time that you have spent. We're going to be sharing transcripts of this press conference, of course, recordings, and also the presentation that was given by Dr. Oluwakure during the plenary session this morning. Please note you can continue to follow RCM 72 proceedings all week through our live stream and on our website, as well as our social media channels. Thank you very much, and we look forward to seeing you online for the rest of the week and for another press conference again soon. Thank you very much.